Hello, good evening, everyone. This is Dr. Sonpal Dagash, ENT and head and neck surgeon. So, main purpose of making this video is like I'm getting recently many DMs and comments about ophthalmology in particular branch and good hospitals in DNB and in diploma, that is NBE diploma. So here we have my friend of mine during my diploma ENT, that is Dr. Rajiv. He is an ophthalmologist and he also did diploma in ophthalmology in the national board examinations through and he is doing secondary DNB now. So, Dr. Rajiv, welcome.
Thank you. Thank you.
This video I'm trying to make it crisp and clear for the ones who are looking for ophthalmology in their counseling through NEET PG 2025. So, see, Dr. Rajiv is very experienced in this field. He has done diploma and then has done some private practice and then joined secondary DNB. And so he has around experience of 3 to 4 hospitals. So first of all, we will start from the topic that what is the comparison between the MD in ophthalmology versus DNB versus diploma in ophthalmology. What is the difference and what should you choose according to your need and region? So, Dr. Rajiv,
Hello.
am I audible?
Audible, audible. So, like,
Yeah, yeah, continue.
if you are getting MS from any government medical college or DNB, so I think if it is autonomous body like AIMS and all, then though you can take MS. Okay, that is okay. But taking MS from any periphery GMC is not a good choice. Like if you are getting DNB from top private institute like Shankar Netralia or Arvind, that is far better than doing MS from any GMC. I am telling. You take any GMC like government medical college of state government medical college of any state that are not up to the mark. Like I work in Bihar also in one GMC. I was medical officer there. Now DNB seats has come, like there it has come. Useless. That is complete wastage of time. Okay. The problem is problem in GMC is that in ophthalmology, equipments are very costly, very costly. Like one phaco machine comes for more than 50 lakh rupees, and like one complete ophthalmology setup, it costs 2 to 3 cr crore. In government medical
Hmm,
colleges, even if government will give,
exactly.
faculty doesn't know how to operate. That is the hard reality. They don't know. They might be thinking that they are the king of that college, that department, but reality is they don't know. That is the fact. They might be knowing, but due to some politics, they will think that okay, if FECO machine works here, then how they will practice outside? That is the reality actually in most of the medical
Yeah.
colleges. So it's better to have good private institute where you do DNB, and I think that is better actually. So if you are getting
So
MS from
basically,
GMC, uh,
so basically, you are telling that if you get MS ophthalmology from any central institute, it's worth it.
mm,
Apart from that, from any peripheral government medical college, it is not
mm,
worth it until and unless
yeah, yeah,
it is well equipped. Until and unless it is well equipped, it is not worth it. So it's better to choose a, good private institute in DNB, which has a
yeah,
good reputation and all the equipments.
yeah.
That there you will get better exposure and better residency exposure as well as hands-on also. So what about hands-on? Like what can one expect in DNB in good private hospital where equipments are full, but still hands-on is quite doubtful because it is a private hospital, of course. So what about that?
No, no, see, if you are getting DNB, then as I know, like I am in Shankar Netralia, Chennai. So Shankar Netralia is having good hands-on for DNB, I am telling, not for fellowship. I am talking only about DNB. For DNB, Shankar Netralia is best. Then you can go for Arvind. People think that in private institute, how they will give hands-on. It is not like that. Every private institute, they are having community center. Community center means they are doing free cases. Okay, So there they will give you hands. They will not give you hands on their private cases. No one is going to give you hands on their private cases. But every like in Shankar Netrali also there is community center where they do free cases. In Arvind also they do camp cases. Like any private hospital where DNB seats are there, they do like camp. In camp, residents mainly they only do the cases. Like they will get the hands on. I can't say they do the cases,
Okay.
but they get too much of hands on. In government, see, uh, I am telling in Shankar Netralia Community Center, every day some 50 to 60 cases, SICS and FECO is done in community center. That is free. In Arvind,
Okay.
my friends, like there are 6, 7 centers of Arvind in Tamil Nadu. So Arvind, I think it is more. They might be doing some 100, double of Shankar Netralia because that is they like the whole concept of Arvind is full camp and camp. And any what I know that most of the good DNB institute they are having too much of camp. Their residents are getting. But you see the government GMC. Suppose in one
Okay.
department some 10 PGs are there, first, second, third year, 10 or 15, 5, like 3 years, 15 PGs are there. They will post 6, 7 cases per day, maximum eight.
Acha.
8 cases in that SR will be there. First, so professor will not do, okay, they are busy. Assistant professor has to learn. They are learning only, associate. Senior resident, then third year, second year, first year. If any medical officer or SMO is there, they will also learn. In 8 cases, there are some 20, 25 people are there. So it's very difficult, and then no one is there to teach also. Like in
So,
government colleges, see,
so till now we have reached one conclusion that apart from Central Institute, DNB is far better. A good private DNB, where it is मतलब class apart, equipments are there. They have community centers of their own, which are also well equipped more than at least the peripheral government medical college. So
yes.
it's of course a better choice. Then see, what about then private medical college? Like, how can we compare private medical college to a good DNB hospital?
See, private medical colleges, I can tell only one thing. Like, suppose if any person, like any student, he is having too much of enough money, like he is having enough money so that he can do MS and he doesn't need loan. If you are doing MS
Okay.
from private college without loan, then go for it. If you are taking loan, like if you have to take education loan, never take MS in private college. Then it's better to
So,
go for DNB.
so private medical college will also be well equipped. That is a fact. But this money, the amount of money we are spending is like it's not affordable for everyone. So that's a major
Yes.
issue.
And
So
hands-on
one
is less there. In again in private there is no hands-on.
again, Acha, someone is asking like Prashant Sal is asking that sir, what about private institute DO courses, the diploma in ophthalmology, private institute.
Yeah. So suppose
See,
if you are
again,
not
same
doing
thing.
no, who is doing DO? Like I only did DO, DONB. So the thing is like if you are not getting DNB or MS in government colleges, then you have two options: either to take MS in private or go for DO. If you are having money so that you don't need loan to do MS from private, then go for MS, no problem. But if you have to take like you have to take the loan, then it's better to go for DO. Never take education loan for doing MS when you are getting DO. That is the better
Yeah.
actually. In DO also
So,
there are many good institutes.
so Dr. Raju is telling that if you are not getting DO in national board course in free seat, then you should think of like DO in private, like it's last option, right?
Correct.
If
That also. Like if you are getting DO NB, it's better to take NB course
uh,
than taking DO from any private college.
so if your rank is
Correct.
like if more than 60,000, I guess in general category, more than 50, 52, more than that, I don't think uh, ophthalmology is available in diploma also. So if your
Yeah.
rank is too far away from, then you can think of private medical college in MS as well as DO. So it's a last option. If you are not getting a good DNB hospital, then take DO in good hospital. That is national. That is run under national board examination.
Yeah.
So, Dr. Raju, can you explain like which are the good hospitals in DNB as well as diploma in ophthalmology?
See, I did DO, so I can tell. Like I have seniors in Shankar Netralia. Like once senior is there, they have done from Sushrut in West Bengal, Kolkata. Kolkata and one more is there. Like there are two centers of Sushrut. One is in Kolkata, another is in Murshidabad. Those two are good actually. But I felt that for DO, that is the best. Sushrut in Kolkata and Murshidabad. If you are getting that, you just take it blindly. You can go for that. And see, if you like, if you go for DO, then you can't get good institute in DO. But do like degree matters. Okay, you have degree, then you can learn the surgery. That is the other thing. But then for DNB, Shankar Netralia, that is the number one. There are two. See, Shankar Netralia and Shankar Eye Hospital, both are different. People should know this. Shankar Netralia, that is the number one eye institute in India. That is having two centers, one in Chennai, another they have opened in Kolkata. Both places DNB are there. You can take at any place. Next comes like after Shankar Netralia. If you want DNB, then is Arvind Eye Hospital. You can take Arvind Eye Hospital. Like there are 6, 7 centers of Arvind Eye Hospital in Tamil Nadu. All are good. You can go to any center that is good only. Then after that, that Sankara Eye Hospital, that is also good. If anyone is getting Sankara Eye Hospital, they can take. Like they can have third option. And that Sankara Eye Hospital, Coimbatore and Bangalore, they are best actually. Bangalore also, Sankara Eye Hospital is there. Coimbatore also, it's very nice. Uh, these are about South India. Then North, like if anyone wants in North, then Gangaram is good. Gangaram in Delhi. Then Shroff Eye Hospital, that is also good. Then that side you can take again in Sushrut, DNB is also there. So those who want DNB in Sushrut, they can take like Sushrut, Kolkata and Murshidabad they are having. That is very good. And one more thing. See, if you have to do DNB, if you want to DN like if you want to do DNB, never do from government colleges.
Yeah,
Because
yes, yes.
again, see, if never do DNB from government colleges, because the problem is again, MS I am not telling to do, then why you are doing DNB? DNB, if you are not having good exposure, then you can't pass exam also in first attempt. Like again, you have to give after 6 months. So you are going to fail because exam is little tough. I can't say everyone. At last, if you write the exam, you will pass only after 6 months. You are passing. But it's if you are doing DNB, always go for private. Okay. Uh, then anything?
So one question is there, like in institution like someone is asking, Tata and Aditya Birla, there are no DNB but directly DO. Is there any advantage? Of course, there is advantage if there are no DNB candidates and only diploma in ophthalmology, like in Tata and Aditya Birla. Dr. Rajiv, have you any idea about this?
There is nothing advantage or disadvantage. If you are getting DNB, take DNB. If you are not getting DNB, then take DO. That is the thing. There is
That's
nothing. If see, Sushrut is having both, like DNB and DO. So you don't think that there will be some discrimination, nothing like that. Okay, no one will discriminate you. Either you go for DO or DNB, doesn't matter.
yeah.
If
So
both are there, you
basically,
can.
we have reached the conclusion that it's better to take in Central Institute. If not, you are getting, then choose a good private DNB hospital rather than any peripheral government hospital where the equipments are not enough. Then
Sure.
again, if you are not left with these options also, then choose a good private institutions where in diploma in ophthalmology that is available through National Board Examination courses, NB courses. Then you can go for that government DNB and government DO for hospitals where uh, equipments are not enough. Of course, you might not learn FACO for sure. And after that completion, of course, you will have to again go for another senior consultant and for fellowship for another 3 to 4 months.
Not only FACO, you can't learn SICS also in
Okay.
government GMC. Hardly there are few GMC where they may give some 5, 10, but no one is there to teach. That is the hard reality of our country. In government medical colleges, like we both were there, Kanpur also we have seen. Uh, then Uttarakhand also, I got transferred from Kanpur. I went to Uttarakhand. There also same thing was there. So it's better
So,
to take
ba-
DNB from
ba-
good institute.
so basically, ophthalmology in general, I'm saying for what I have experienced over the years and what colleagues I've met and what they are telling, like ophthalmology is totally a microscopic surgery. And it has a long learning curve. So until unless you enter a good residency program where the hospital is good, hands-on is good, the consultants are good enough to guide you, and like you need a good guidance. Otherwise, you might feel that branch is saturated. You are not getting enough hands-on. You might end up leaving the branch.
Correct. And one more thing I will tell, like you also know that gonioscopy we do in ophthalmology. I had
Hmm.
seen when I was in Kanpur, I had seen in medical college, SR, senior resident, they were not knowing how to do gonioscopy. Why no? Because in my medical college also, when I was doing DO, there was no gonio lens, no applanation tonometer. So people after doing degree also they don't know how to do applanation tonometer for IOP. Then gonio to that is very big thing. I had seen senior resident they were learning gonio. And if you come to any private institute like Arvind or Shankar Netralia, in first month only everybody learns applanation tonometer and gonio in Shankar Netralia, even in Arvind also. That is
So
the difference.
this brings me like we were talking now, like the main thing is people talk about saturation in ophthalmology in particular, because this thing is related to that saturation topic only, because people feel like the branch is saturated, but actually the branch is not saturated. In the periphery, I have seen the surgeons, like ophthalmic surgeons, are really less in amount for what we think they might be in the periphery, but they are less. The proper ophthalmic surgeon who are operating everything, SICS, phaco, and other things also are very less.
Mhm. No, in ophthalmology, there are two type of surgeon. One is oral surgeon, one is real surgeon. So out of 10, 6, 7 are oral. Like by mouth, they are surgeon, but they don't know how to do surgery. Only 3 or 4 will do the surgery. So they are the real surgeon. So you have to compete with the real surgeon, not with oral surgeon. Because we both were in Kanpur, we had four, like in ophthalmology, we had four faculty. No
Okay.
in any hospital, most of the hospitals. But you should know the surgery. If you don't know the surgery, then no one is going to take you.
I want to add something in this also, because ENT is also somewhat like this. Because after MS ENT also, there one comment is also there. Matlab, uh, he might have seen many MS ENT surgeons sitting free idle, and that is fact. Even doing MS ENT from top-notch institutes, the people are not skillful enough to do all the surgeries. So if someone is not skillful, of course he will feel the branch is saturated. He will feel the branch is useless. So it's the
Yeah,
same goes with like ophthalm. The same goes with ENT also, because ENT is like endoscopic, microscopic, plus
correct.
macro and macro surgeries also are involved. All head and neck cancers, onco, then plastic surgery. So variety of surgeries there. So if even if you are expert in one to two surgeries, initially you might feel that I'm not getting enough cases, because you are not named, you are not like a famous surgeon over there. So even if you are expertise in one to two surgeries, then you might not get famous, and you might feel that branch is saturated, cases are not enough. So the ENT is like you have to operate full head and neck, then and then initially, then and then only you will feel that nah, branch has something interesting. Then after that, after few years, after 5 to 10 years, you might shift in subspecialization, and you might end up doing few surgeries within head and neck. Then it's good, but still initially it's like very difficult if you focus on few surgeries only. So it's like that. So what about like even a fresh diploma in ophthalm or DNB or MS ophthalmology passes out in current scenario? What salary he can expect apart from SR ships and all? SR ship, like everybody has the similar salary. Apart from SR ship, if he thinks to go in the private sector, as in job, like salaries perspective, what salary one can expect and what is the demand currently?
See, there is if you know I told if you know FACO and SICS, you can easily get 2.53. And it depends on location also. Like if you are in Tamil Nadu, there is not I can't saturation. There are many doctors. Still job is there. So their salary will be less. You will get job. There will be less salary. Like if you go to North India, like in North India is having huge backlog of cataract cases. Okay. Their salary you may get 4-5 lakh also. If you go to Bihar
Okay.
and all, 4-5 lakh. If you come to South, 2.5, that is like that. And if you go for your own setup, then there is no limit. But you should know the surgery. Like if you take surgical
Yes.
branch, you should know the surgery. If someone is asking that post PG starting your own OPHTHA setup is very costly, then any surgical branch it is costly. For any
Yes.
surgical branch, if you have to start your own setup, so if for everyone it is costly. And it's not that if it is 2 crore cost, then you have to like invest everything from pocket. You get loan for that. Okay, once you are full expertise in that field, you can get loan. You take loan, you take risk, you take loan, you open a setup. You can easily pay in 2-3 years.
You can start your
Like
own setup in lease also, but you don't have to invest too much. Like in instruments and all, I guess I'm not expert in ophthalmology, but I know a few people who have done their own setup recently. Around they go,
oh,
it costed them around 40 to 50 lakhs, and apart from the lease.
yeah.
So 40, 50 lakhs initially might feel a big thing, but still people who are spending 10 lakhs, 15 lakhs per annum fees for MD and MS in that ophthalmology, uh, it's nothing for them. So
Not
it
20-25 lakh for PG
20,
per year.
definitely.
So 60-70 lakh you are spending there for PG.
So
So,
setup is
so
not
for
that
any
costly if you think like that.
no, for any first generation doctor, like if you are the first generation doctor in your family, and if you want to set up anything, it is costly. Anything, it will be costly. But it depends on your skill and how much you can take the risk. Your risk taking capability, that also matters a lot.
So basically, sir is telling like we were talking also in the evening, like if an ophthalmologist thinks like he wants to boom in this field and he wants to be at the top of their skills, like surgery is the only option. There is no other
Yeah,
option,
no other option.
right?
No other option. Correct.
It's same like ENT. People also think like ENT is a blend of like medicine and surgery. It's not like that. If you don't know surgery, I don't think any ENT physician can boom as such, because there are already
Yes, correct.
GPs working on it. There are all quacks, and there are a lot of general physicians, general medicine, family medicine people who are treating overall the generalized body illnesses, including ENT, ophthalmology, everything. So if you don't know the surgery, I guess the only thing like you need to focus on before joining residency is like focus on skills. Surgery is the only thing like you should focus on apart from anything
And
else.
one more thing is that if you have degree, no surgery you can learn. Man, that is not the matter. Surgery, but only it will take time. Like see, those who want to learn the surgery, everyone learns that, but it takes time. Like if you are learning, suppose if anyone has done some 100 FACO in DNB and 200 SICS, and one who has done only 5 SICS and no FACO, then for that person it will take time. But if you are
Hmm.
in this field, if you want to learn, you can learn. Like now, though it's paid also. Many paid fellowships are there. You can go for that.
So yes, this is an OPHTHA session. We are talking about ophthalmology, and in the last we will talk about ENT versus ophthalmology because people with similar ranks like get confused between these two branches. I don't know why, because these are totally different branches. Like, you know. One thing I want to add that in ophthalmology, jobs perspective, what I have seen in current like within 2 to 3 years, like job requirements comes around 1.5 in periphery, like on a higher end 1.5 to a 2.25 lakhs per monthly. And if you know the SICS things and FECO is necessary right now, है ना? Then in
Correct.
center in center starting initially 1 to 1.5 lakh you might feel like it's less. It is less of course because the number of eye centers in the tier 1 cities have increased drastically, and so that's why the number of cases are also like divided. That's why the salary has gone little bit down in the center. But I feel seeing the branch in the future the geriatric population is going to rise like anything,
Yeah,
because
correct,
the middle adulthood and above 40 population is going to rise in next 10 to 15 years. Then of course cataract is the major issue, major public health issue, like ever it is an
and and
evergreen plan.
and
But I think
and
putting your putting your own setup will be a better option rather than looking for jobs. You
correct,
attain your skills anyhow after, even after residency you do some fellowships and all, and if you are confident enough and you have the money to set up your own thing, like it's a very good option rather than looking for jobs here and there.
correct.
So another thing, like we talk about saturation, we talk about salary and the branch potential. Branch potential is of course very high. Now, I guess we will talk about ENT versus ophthalmology. Like people, I don't know, branch wise there is no confusion. I think there is two totally different branches, but still the rank which they get and seeing the previous cutoffs, they get confused like what to choose between ENT ophtha.
See, it depends on like I can say that like if you want any gross surgery to do, like big surgeries, gross surgery,
Yeah.
then ENT is better. Like ENT, you are having the feel of gross and micro both. Gross is more surgery. Like micro, it's when you go for some neurosurgery. I think neurosurgery and CH you are eligible. There and for ear also, no, that microscope people use that ear
Actually,
surgery.
actually, it's not totally like that. Like in ear surgeries, few things can be done by naked eye, and few things need a microscope. And
Please,
in like in nose also, like nose and sinus, like septoplasty can be done naked eye, and of course face and all everything. Endoscopic sinus surgeries of course needs an endoscope and very good setup for that. So one thing I want to mention, like ophthalmology has very the operating time is quite less, and plus there is
yeah,
no
that is
general
correct.
anesthesia required. So that is the major pro which I think, like the timing of surgery, and plus there is no anesthetic required. So your cost cutting
No,
is too much. You get the full benefit
it's
from the sinus,
fully
like
independent branch, fully
full
independent.
independent practice, like.
You can open a autonomous, like you will become autonomous body. No need for anyone like that.
And also one thing, like if you focus on only one thing, like you don't need to do that vitreoretinal thing. It's not necessary, right? Because the number of cases which are there, and that is not, like it's not mandatory. If you, even if you don't do, it doesn't matter. Like you can do general ophthalmology and you can flourish like anything within after 5 to 10 years of practice, you can flourish like anything, like even after focusing on the general ophthalmology thing. But the talking about ENT, like ENT, initially I told that initially you need to focus on each and every aspect of head and neck, otherwise you will feel lost. You might feel the case number of cases, like if you focus only on ear, then you might feel um, of course that depends, also depends on the regions where you belong and where you are practicing currently. Because in major tier 1 cities the number of CSOM cases are less, because there is posh population, and there is no so low social status classes people. Like the majority of diseases of ENT are related to low social status. But the that is not true for the cataract. Cataract anybody can get. Like
Yes, and ophthalmology has become
paying
very
capacity of the patient
cosmetic.
for ophthalmology is also high as compared to ENT.
And the one more thing is there. No, like every people have two eyes. So if
Yeah,
India
yeah.
population is 150 crores, then 300 crores patients are there. And other thing is like it has become cosmetic branch also. Like now LASIK and all those things have come. LASIK and like for those things you don't need to do anything. Like once you purchase the machine, they will only have like you will have some 15 days fellowship for that. That machine people will only arrange, and you can learn. Those are machine based only, and that there you can learn a lot of money. Like if you put a LASIK machine and like that, then income is too much. So that is cosmetic procedure actually. That way. It's,
So I also want to add one point also. Like if you are not passionate about like ophthalmology, if you're not passionate about that microsurgery, and if you are anywhere confused, like if you don't attain that skill, that happens with many ophthalmologists after entering the residency and few years after doing the residency, they feel like they are not made for ophthalmology. Like it's very
correct.
kind of surgeries, na. Yeah, no, everybody cannot be sure before entering residency that I will be good in this. Everybody cannot be like that sure. And that in that thing, ENT gives you the liberty, because if even if you are not good at microscopic thing, you might be good at endoscopic thing. If you are not good in both, then you might end up doing thyroid parotids and plastic surgery, rhinoplasties, and maxillofacial trauma. So
Correct.
there are options, variable options.
And then one more thing, you can go for MCH also in ENT.
Yeah, definitely, because recently the four MCH branches are also available. So if you are thinking like in future you want to do MCH, you want to add the degree, like there are more chances of doing MCH in after ENT than ophthalmology, but because of the
No,
vitreoretinal
ophthalmology,
MCH is there.
only 2 3 seats are there in ophthalmology for MCH.
And that national institute, so only fellowships may be available in that, but still, if you want to do MCH in future, like you want to add that tag, then ENT will be a better choice.
Yes.
Like but in general I think if you are money minded, if you are only concentrating on money, and I think, and if you have the backup money for your own setup, ophthalmology will be better, and if you are interested in microscopic. But otherwise, if you think if you want to get an experience of blend of everything, like maximization trauma from plastic to onco to basic ENT, then ENT will be a better choice.
Correct.
So there are few questions. Let us answer that, and let's end this live after that. So
Hmm.
future of like physical medicine and rehabilitation. See, PMR branches are like DNB is also there, but MDPM are majorly are running in the central institutes, and of course it is a see, if you see the curriculum of the PMR, you might feel that it's a very good branch, and it is of course, but job wise, salary wise, I don't think so, because apart from tier one cities and there are big setups, you might not get enough jobs in the peripheries. You might be forced to put your own setup with
One
in adjunction with that orthopedicians and physiotherapists. You can
uh,
do that, of course. Yeah,
one
yeah,
more thing, like in any branch, suppose in PMR, if you do from AIMS and all, they have good setup of PMR. Okay, but the problem is that suppose you open a clinic outside, patient should know what you are doing. Like patient don't know what is PMR. Then suppose if you open a clinic also, then also they don't know what is PMR. Like outside, they consider physiotherapist as PMR, like that. So that is the problem with PMR. And
so
second thing is
yeah.
that earlier that in NMC curriculum that this branch was important for starting a medical college. Now they have removed like this and emergency
Yeah,
medicine. What I know. So this
emergency
PMR
NTP
no.
also.
So PMR for PMR branch you are not going to get that much easily any job in medical colleges. Like orthopedician they are doing that. That is the actually problem with PMR.
Yeah, but matlab, it's like if you want to do PMR, you might have to get these major centers only, because they
Now
only
correct.
have that department running. Like in
Corporate
peripheries,
hospitals.
corporate big corporates and central institutes where they run the full-fledged PMR department. So that's the only con. Like otherwise, branch is good, everything is good. We work in a corporate hospital while preparation. Yes, of course. After diploma in ophthalmology, like Dr. Rajiv was also working in a private sector.
Uh,
If you know the surgeries, you can of course do everything in the private, and then whenever you get the chance for secondary DNB or when counseling happens, you can again join that. It's not issue, not a big
and
issue.
And say for secondary DNB and all, there is nothing preparation. Okay, it's not like NEET
Yes.
PG. Suppose in our time, like we 130, 140 people wrote in ophthalmology, and there were 290 seats. So number of seats are more and applicant are less. Okay, so there is nothing preparation that you have to sit and write. For next 2 to 3 years, it will be like this only. After 2 to 3 years, it may be like applicant may be more and seats less. But now seats are more than number of applicants. So
One important question like litigation, that is a major issue in surgical branches. That is definitely a big issue in every surgical branch. More in like gynec and obs. Then general surgery, see litigations. I think general surgeries, the number of because of the number of cases are more in that branch. You might hear more about the litigations, but still the risk of litigation, which one surgical branch that carries is gynecops, then ENT of course, because head and neck, that facial nerve palsies and all. You do anything in facial region, in and around head and neck region. Like if you are operating. Bronchocyst, thyroids, parotids, that very sensitive areas, and oral cancers, larynx cancers, they were very sensitive. Orbital platings, like very sensitive areas. So litigations are of course more in that chances of, but talking about the quantity and that magnitude of that litigations, there are for more in general surgery, in every surgical branch, of course. In ophthalmology, Dr. Raju might tell better.
in ophthalmology, that much of litigation is not there, but see, there is a risk. Like if you do 10 cases, there is a risk of infection in ophthalmitis. That is there. I have seen like at many places in Kanpur only once it happened that some ophthalmitis at end of. That is the only risk. Otherwise, ophthalmology, there is not that much risk. Only infection is the only risk there in ophthalmology. What I feel.
Okay, so is ortho also carries a whole lot of risk in the like litigations and all, because wherever the disability is involved, the risk of litigations are of course more. If you are talking about general surgery, there is no disability involved in that. Of course, life and death scenarios are there, but still disability and all, like they're also carrying equal amount of litigation risk and all. Ophthalmology, ENT, and then orthopedics too much.
In any surgical branches, that litigation is there, but that is not the thing. For that, you should not take the branch. Even in medicine, also it happens. General medicine, if you give any treatment and patient died, then litigation will be there.
But in general, I've seen like in general medicine branches like that, there are many gray areas in that. People like tend to escape. They might like put curtains on their complications, even negligence also. They have that liberty, na, that ICU, nobody knows what's happening, what has happened.
No,
But in you have taken like you have taken full responsibility according to the patients. We have taken 100% responsibility. Once the patient goes into the operation theater, we are 100% responsible whatever happens in that. So we that no, window of escape, like it's less for any surgeon.
see, those are like litigation and all. Those are very rare things. So rare things. I don't know what will happen with which patient. In ophthalmology, also it has happened that 90 years old, they have gone for cataract surgery, and the patient got like heart attack there only on the table. The patient will die that time
That's,
only.
like in that's not,
Rarest of rare, it has happened.
of course. So like I think he is asking like if a patient comes to you for cataract surgery, and well, if you are not able to give him or her the vision that he wants, that is it like that they might sue you in court?
You are correct. You are telling correct. That pre-op examination is very important. Like if any patient comes for cataract surgery, and if you have not examined the retina, and if there is some retinal pathology, you will tell that 50,000 rupees lens you put, vision will come. Like that, if you tell, then if there is retinal pathology, vision will not come. So you have to inform the patient before only that you are having some retina problem, vision may not come. Like that. So that is the thing. If retina is okay, your surgery is okay, then vision will come. That is there.
Okay, so I hope I will put this video in my YouTube channel also, so you can see later on also. So we will end this live, and thanks to Dr. Raju for joining this. And
Thank you, Dapesh.
hope after listening to this, you are very much clear about what to choose, and few institutes also that Dr. Raju has told that are very good class apart, and what hospitals to choose, like, and what institutes to avoid in residency. So
Yeah, correct.
okay, good night.
Okay, thank you, Dapesh. Good night.